Hello my friend, welcome to medical science class. As a student of medical science, I wanted to take flavor and good of science. What is science? Science is anything, any matter, any good, any copy, any occurrence can solve by logic, document, matter, in number, calculation, and movement with experimental science. What is medical science? Medical science is the branch of science described laboratory about creation like human. Scientific name of human promotion. Now, how much question? Ya alif lam lam ha yallah shafi yallah mafi yallah kaf ana abdul mamashul shafi ana abdul mamashul mafi ana abdul mamashul shafi ana abdul mamashul shafi ana abdul mamashul shafi ana. Now my friends of our medical science class, which is elaborated about medical science. Now you know that and, management of fever. In case of fever, come. How we manage your fever? Fever, if your body temperature equal above 99 degree Fahrenheit, you diagnose as a fever. And what is the reason of fever? And first management of fever. If your body temperature equal above 102 degree Fahrenheit, equal above, then you give paracetamol or acetaminophen suppository at 500 milligram per day. What will the fever below 102 degree Fahrenheit? Now exclude what is the cause of fever. Cause of fever: infectious fever, traumatic, or other reasons. Infectious fever is bacterial fever, antibiotic; if viral fever, antiviral; if fungal fever, antifungal; if protozoal fever, protozoal like protozoal fever, antiprotozoal; in helminth fever, anti-helminth; and if kalajor, then what is the treatment protocol? In case of kalajor, sodium stearate. In case of malaria, quinine salt. And that is the fever management. Simplify. How you understand the fever? Then investigation. In case of investigation, CBC with ESR. In case of CBC, you found the WBC rise and RBC. If you see this WBC, CBC complete blood count, you found the WBC rise. Infectious fever or generally WBC rise. And in case of dengue fever, reduce the platelet count. Dengue, chikungunya, reduce platelet count. In case of dengue fever, what is the management? NSAID is contraindicated. You give the paracetamol. If pain is more, then paracetamol. Suppository, oral suppository, acetaminophen. If pain is more, IV route paracetamol, IV acetaminophen, IV. But in case of NSAID is chikungunya, dengue fever, that is contraindicated. In case of RBC, in case of investigation, you found the RBC slide hot. In case of dengue, chikungunya, in case of serum blood count, and you found that the infectious fever, bacteria, virus, or case of dengue fever, there is the germ of dengue, or other fever, malaria, kalajor. In RBC slide, you will found the organism. And what is the organism? That was the treatment. That is the management of the fever. And if the shock develop the shock, then management of the shock. By infectious, develop the what is shock develop? In infectious, there is a septic shock develop. If septic shock develop, what is the treatment? In antibiotic. If bacterial sepsis, antibiotic; viral sepsis, antiviral; protozoal sepsis, antiprotozoal; helminth sepsis, anti-helminth; fungal sepsis, antifungal. And and sepsis developed to Calazone, sodium isopropyl and malaria quinine. That is the fever medicine. How you understand the malaria and Calazone? By malaria is thick film. In thick film there is a sapiens, and thick film there is a organism. In Calazone, you know that organism of in blood there is an organism of Calazone. You found that, and that organism. That is the fever. In case of TB, Mycobacterium tuberculosis, we found the slide TB, sputum test, was generally sputum we found the TB, and TB organism, and in case of TB treatment, 3 months to 6 months, isoniazid, tiacomycin, paracetamol, ethambutol. That is the treatment protocol of the fever, was generally. Then there is another traumatic fever or other fever, but was generally